One of the biggest decisions that you have to make when you're on Medicare, especially when you're new to Medicare, is whether you're going to enroll in a Medicare Supplement plan or in a Medicare Advantage plan. And however you've done your research, you have probably come across some very strong opinions about Medicare Advantage. Now, here's the funny thing. Despite all of these very negative comments, Medicare Advantage is still the most popular type of Medicare plan by far. So then, why is it so popular if all these things that YouTubers are telling you are true? I mean, if all this stuff were true, then wouldn't people be leaving and running the other way? But instead, it has been growing in popularity every year. So there's got to be something there. So let's find out why. First, let's take a look at a real cost example that goes over the cost differences between original Medicare, a Medicare Supplement Plan G, and a Medicare Advantage plan. This is really good because original Medicare, obviously, that's what you would have if you had no Medicare coverage other than what's comes from the government. Medicare Supplement Plan G is considered the highest. It is the highest Medicare Supplement plan that covers the most, and then a typical Medicare Advantage plan. So for this example, we're going to use a guy named Bill. He is 65 years old, and he is from Indianapolis. So I'm going to use real examples of plans from Indianapolis and give you an idea. Now, remember that plans are based on where you live, my disclaimer that I always give, and it can vary from place to place. That's why we chose a city of Indianapolis. So let's say that Bill spends 3 days in the hospital and takes a few prescription drugs, namely atorvastatin, Lantus-Solostar, and levothyroxine, very common medications. Now, using this information, I asked my team to pull some real plan numbers from Indianapolis, which I am going to show you here. So again, real stuff from Indianapolis comparing these three plans. First, I'm going to show the cost if Bill chose to stay with only original Medicare and did not have a Medicare Supplement or a Medicare Advantage plan. Now, as you can imagine, this is going to be a pretty big mistake. But let's start with the Part B premium. The Part B premium is $185 a month. Now that's the same all across the board, of course, because that's the ticket to the game. You have to have your Medicare Part B in order to get any of these plans. And so it's assumed across the board that you're going to have a Medicare Part B in order to participate in any Medicare program. At $185 a month, that's $2,220 a year. So I'm just going to put over here on this side, you know, Part B is going to cost you $2,220 a year in 2025. It's going to go up slightly in 2026. The actual amount for 2026, we know what it's going to be, at least it's forecast what it's going to be, but it has not been announced yet. But for 2025, $2,220 is what you're going to pay every year to have Medicare Part B. Everyone pays that, no matter what, okay? So that's across the board. It's like your ticket to the game. Okay, the next category is the plan premium. There is no additional premium, of course, because we're saying that Bill was on original Medicare. Now, what about the hospital stay? A 3-day hospital stay, what will it cost on original Medicare? Well, on original Medicare, you have your Part A deductible. That is going to be $1,676 when you first go into the hospital. You have to pay that deductible, and so a 3-day stay would include that. Now, what about doctors, specialists, and tests? 20%. What about Part D premium? Well, original Medicare doesn't cover and doesn't come with drug coverage, so there would be no premium there. But what's your coverage for drugs? There is no drug coverage, which means, I would say this means he's going to pay 100% of all drug costs because there is no coverage for medications on original Medicare. So you can see that's really risky. So what is exactly that going to add up to? Well, I can't tell you because the reality is it's just uncapped. So we don't know what it's going to add up to. And what does it total cost in a year? Well, I don't know. The sky's the limit, right? It could be a lot of money because you're going to pay the premium, the $2,220 for Medicare Part B. You're going to pay $1,676 every time that you're hospitalized, not just the first time, but every time, and 20% on pretty much everything else. No drug coverage. I mean, it's what we'll call it in the tens of thousands in this scenario because it's going to be very expensive and the medications aren't cheap, right? So not a good idea to be on original Medicare, which I'm sure you already know that, so I don't want to belabor the point, but it's not a good place to be.
The annual enrollment period is upon us, but it only lasts until December 7th. I always recommend that you shop for Medicare plans to see if you can save money or find new benefits. And if you want help, you can call us at the number on your screen and we will show your options at no cost to you. Okay, now back to the video.
This was the risky option. Let's go now to the Medicare Supplement Plan G, which is the most popular type of Medicare Supplement plan today. And you'll see why. First, the Medicare Part B premium, well, he's still going to pay the $185 a month. Everyone has to pay that. Also, the premium for Medicare Supplement Plan G. And Indianapolis, the average price for a Plan G is around $165 a month for someone who is turning 65. So again, this is the lowest cost it will ever be. It's going to go up every year. But the plan premium is $165 a month. Now, we're kind of also doing an annual scenario here where we see what the annual costs are going to be. So I've done the math on that. That's $1,980. That's right here, $1,980 a year. That was easy, very easy for me to remember because, of course, I remember the year 1980. You know, I was 5 years old in 1980. So $1,980 a month is the annual premium for a Medicare Supplement Plan G in Indianapolis for someone turning 65. He won't have to pay anything for the hospital stay. His cost for hospital would be zero. Well, how could it be zero? Well, because the Supplement Plan G is going to cover all of your Part A costs at 100%. That's great, right? Now, what about doctor's visits, tests, specialists, etc.? Well, he has his Part B deductible, and in 2025, that is $257 annually. So, one time he's going to have to pay that, and then it was going to cover him for the rest. All of the rest of the stuff is going to be covered at zero. Just have to pay the $257 annual deductible. But you do have to get a standalone prescription drug plan because Medicare supplement plans don't come with drug coverage, just like original Medicare. The important thing with a Medicare prescription drug plan is you have to look at the prescriptions you're taking. Yes, there might be a zero premium, $0 a month option, but does it cover your medications and is it going to end up costing you more in the long run? That's kind of what we looked at. And we found that the better Part D premium plan for him was $29 a month for that plan. Again, I did the math, that's $348 a year. So the annual is $348 for the year. That's for the Medicare Part D plan, just to have it. In addition to that, we found that those medications that I listed, it was going to cost him $51 a month to fill those. So in addition to the premium, you've got $51 a month to get all of your medications. That's per refill, right? So every time he's refilling, $51 a month. And that ended up being $612 a year. So we took the total of all of this, we added it up to give us what the cost is on a monthly basis. And for Bill, the monthly cost of his Medicare Part B premium, his plans premium, as well as his Part D premium and his refills and things like that, that is adding up to $687 a month. So right here, $687 a month. What is that on an annual basis? Because we want to look and see, how much is he going to spend for the entire year? Well, that adds up to $5,417 a year. So I'm going to put here $5,417 a year. That's quite a lot of money, right? It's also really great because it's quite predictable for him. No matter what happens, he's going to have coverage because of his Plan G, but that's a pretty significant sum of money. So let me show you what the same scenario on a Medicare Advantage plan in that area would cost, which might show you why it can be quite popular. Of course, there are trade-offs. I am not going to downplay any of the trade-offs, but I want to explain why are people going this route and why it makes a lot of sense for a lot of people. Okay, so let's again say you've got your $185 premium. That's the same for everybody. I always include it because I want you to know that it's there. But honestly, it's a little bit difficult to use it in a comparison like this because everybody's going to pay it, right? We want to know what the additional costs are. But anyway, let's say that he went and he enrolled in a $0 a month plan, Medicare Advantage plan. So he's not going to pay additional for that. A $0 Advantage plan, there are a lot of them in Indianapolis. And for the hospital stay, what we found is that the most common cost was $325 a day for up to 6 days. So $325 a day, and we said a 3-day hospital stay. If you take the $325 times 3, that ends up being $975 for a 3-day hospital stay on the most common, plan, the one that we chose for this example. Meanwhile, what are the costs for primary care specialist, doctor, etc.? Well, primary care, we'll call that PCP, was $0. Specialist was $10. So a $0 copay for primary care, a $10 copay for specialists. What about diagnostic tests and x-rays? Well, they varied. For tests, tests were from $0 to $25 is what we had on the most common plan that we pulled. So from $0 to $25 is your testing. What about your Part D premium? I mean, do they have to pay in order to have additional coverage? Well, here's the great thing about the plan is that it already includes it. So there isn't any additional Medicare Part D premium. And then we said, well, let's look at his prescriptions and see what the prescriptions look like. Because, prescription drug costs is a very, very critical part of how much your plan is going to cost. And not only does the plan have built-in prescription drug coverage, but many times the Medicare Advantage plan usually has stronger prescription drug coverage than a standalone prescription drug plan. In fact, we found that in this case, for this plan, that we use those actual medications for on an actual plan. This is not made up. Actual medications on an actual plan in Indianapolis, it was $1, as low $1.36 per month for refills. $1.36 per refill. So, that's like, I don't know, $15 a year versus $612 a year on a standalone prescription drug plan, because the Medicare Advantage plan had stronger prescription drug benefits. So that brings our monthly costs to $1,196, $1,196, and our 36 cents, don't forget that, right, is our monthly cost in this example. So if we take the yearly cost, even though we had the monthly cost here, we did that because we said he had a 3-day hospital stay, but he's not going to have a 3-day hospital stay all the time. So when we took the annual and added up, it was actually only $3,246, $3,246 and some change for the total annual. Now that is significantly lower in this example than a Medicare Advantage plan, because we were saying a 3-day hospital stay, he's not going every time. I will also add that this plan had a maximum out-of-pocket, the one that we gave you the example of, and the maximum out-of-pocket was very similar to the actual out-of-pocket for the Medicare Supplement Plan G. So that maximum out-of-pocket is the place where you reach that and you're not going to pay any more for the rest of the year. Now I'm looking at this board and I'm thinking, I hope you were listening, because it'll be a little hard to read after the fact, but I hope you understand what I'm sharing. This particular plan, I have the maximum for this plan. I said it's similar. It's a little different than similar. The maximum for this plan that we did was only $3,900. That was the maximum. So your worst case scenario over there is better than essentially your best case scenario over here in terms of cost, right? That's not the only thing to think about. I want to be very, very critical, very, very cautious, I should say, about how I explain this. But when it comes to cost, if you're in an area like Indianapolis, you can't blame people for choosing Medicare Advantage. It's just more affordable and has a lot of other benefits. Not to mention that Medicare Advantage plan had a lot of benefits that you're not going to get on a Original Medicare or Medicare Supplement Plan G. So if you don't use the plan very much, then a Medicare Advantage plan is always going to win. If you use it a lot, then maybe the Medicare Supplement plan is going to be close. But when you include prescription drug plans, the Medicare Advantage plan almost always wins out when it comes to cost. And that is one of the important considerations when you're deciding what kind of plan that you want. Okay, now that you know what the costs actually look like with real numbers, let's go over 2 super common things that people say about Medicare Advantage. Then let's talk about what the unbiased truth actually is in these things. And the first has to do with networks. You'll hear a lot of people talk about Medicare networks and how bad or good a Medicare network is. They make it sound like if you choose Medicare Advantage, you'll be super limited. I'm going to put this here. Super limited in the doctors you can see and in what's available to you. They say that you're going to have very few doctors, very few specialists, very few hospitals, where if you choose a Medicare Supplement plan, which is what they're trying to sell you, by the way, then you can get any doctor in any hospital in the country. Yes, Medicare Advantage plans have networks of doctors and hospitals that they work with. However, this whole idea of them always being super limited just isn't true. You have lots of choices when it comes to Medicare Advantage plans. There can be dozens and dozens, and sometimes 40 and 50 and as many as 100 in some places like Southern California. Lots of choices of Medicare Advantage plans and doctors and networks. And we can help you oftentimes find that your doctor is in a network. But you may not have all of your doctors or all your specialists in a network. Sometimes that happens and you have to say, well, let me consider a way that I can get all of them together. But most people go to their primary care doctor and say, who should I go to for a specialist? And their doctor refers them to someone that they work with. And those people are often in the network. So the idea that you have a super limited network, not always true. In fact, usually not true. We can usually find your doctors accepting Medicare Advantage. Now, the place that we do see limited networks and issues oftentimes with networks is in rural areas. If you're in a more rural area, finding a nearby doctor that accepts all the Medicare Advantage plans or even a Medicare Advantage plan, that might be the place where it's more challenging. But if you live in a more metropolitan area, well-populated area, networks really aren't as big of a problem as they will tell you. Also, another thing that people forget to mention is emergencies. In an emergency, everything is in network. You can go to any ER. You can go to any urgent care, right? In an emergency. I mean, how often are you traveling and you want to see a cardiologist in another state? You don't, right? You want to see your cardiologist that you work with in your hometown. But in an emergency, you can go to any hospital. Every hospital becomes in network when there's an emergency. And you will be treated and you will be stabilized and taken care of. And you know, at some point you need to return home and then see the doctors in your area. Emergencies open up the whole country and in many cases the whole world to coverage with the Medicare Advantage plan. Now, in addition to that, there are some Medicare Advantage plans that are PPOs. And a PPO equals, you know, large network and out of network. So with a PPO, you can go to any doctor that will accept your plan and you can pay more for it, but have a very broad network. So the idea that networks are super limited, and that's what they say, well, that's just not really true. There are many, many options. Or I would say maybe it's true in a few cases, but for the vast majority of people, there are a lot of options. So I would say that the network issue is mostly a ghost problem created by agents and YouTubers who want to sell Medicare supplement plans. It's in reality, for most people, we can find your doctors and hospitals in a Medicare Advantage network most of the time. Now, the second thing that people say a lot on these YouTubers especially is prior authorizations are terrible, that Medicare Advantage plans are run by for-profit insurance companies, which, by the way, is not true. There are many not-for-profit Medicare Advantage plans in addition to for-profit Medicare Advantage plans. And they say that they're going to do everything that they can to deny you care. They say that even if your doctor says that you need treatment, your Medicare Advantage plan won't allow you because they're greedy and evil, right? So yeah, they're saying, you know, insurance companies, what they say is that they're trying to make money, that they're very greedy, right? They say that they're for profit, which is only partly true. There are many not-for-profit plans, right? So this is what you hear: money hungry, greedy, for profit, that they will always deny care when they can. And that's the dominant discussion point that we hear oftentimes about insurance companies and Medicare Advantage plans. And you know what? Yes, there are Medicare Advantage plans that have prior authorization requirements. Absolutely. Prior authorization is a thing in all insurance. By the way, it's even coming to Medicare, original Medicare. I put a video out about that if you want to learn how original Medicare is even saying we've got to consider prior authorizations. The reality is the numbers tell a completely different story than what YouTubers are saying. One study from the Kaiser Family Foundation showed that on prior authorizations, 6.4% of prior authorization requests were denied, which means that 93.6% of prior authorizations are approved immediately. So check mark. I say immediately. I don't want to use the term immediately, but I want to say that they are approved on request, okay? That's not maybe different than what you thought, right? 93.6 are approved immediately. Could you say that 5% of the time the insurance company should ask a question. Is this medically necessary? Has the prior pre-work been done? That doesn't sound too out of reach to me, but this is a big hot point right now. So I don't want to upset anybody, but people who are denied care, so that 6.4% that are denied care, they then have the opportunity to appeal. We've been working on this for a long time. I've been in this industry for a very long time. I've been helping people with Medicare for over 15 years. Usually when something's denied, it's because there wasn't proper paperwork documenting the need for it. And that usually goes back to the doctor's office, and the doctor's office is what's behind the issue of denial. Well, it's not quite that simple. Sometimes the systems make it difficult for the doctor to submit the information, but long story short, the information that the plan needed to show that what the doctor said was needed wasn't there. And so you can appeal that. And sometimes it's appealed by the patient, sometimes it's appealed by the doctor, but around 81.7% of appeals are approved. So when you appeal, it's approved 81.7% of the time. So that leaves it for a very, very small chance of denial. It does sometimes happen that things are denied. I would say that if 81% of the 6%, so that means we're down to less than 1.5%, 2% that are actually officially denied when it's all said and done. Could you say that there's room in your thinking to say that 1% of the time, the things that are requested maybe aren't right and should be, and that 1% of the time, we should push back on a doctor and say, are you sure that that's the right thing to do? I don't think it's so far-fetched. But some YouTubers, they present prior authorizations like this is something that's designed to extract money from you and deny care. But in reality, Medicare Advantage prior authorizations are very similar to the same things on employer plans, to the same things on Obamacare plans or ACA plans. And you've never had a problem with it, right? Maybe you have, but most people have never had a problem with it. It's the same thing with Medicare Advantage plans, except that Medicare Advantage plans have star ratings. Other plans don't have that. Your group plan didn't have a star rating. Your ACA, Affordable Care Act, Obamacare plan didn't have a star rating. And why is that so important? Star ratings affect the insurance companies. We talk about greed, right? Star ratings affect the insurance company's money. If you are unhappy and you complain about the plan, it affects their wallets. So these prior authorizations that get denied, they truly have to be for the right reason, or else it can literally affect the plan's star ratings and their money. So now that you have heard the truth about Medicare Advantage and why it's so popular, I hope that you have confidence and clarity to make a smart Medicare decision. Don't make the decision based on a YouTuber who has got a video that's just throwing out a bunch of shade, as they say, right? And is really pushing Medicare supplement plans. Every case, the decision should be made differently for you as an individual. You should make the right decision for you, and you should look at all of the options. Do I believe that Medicare Advantage is the right thing for everyone? Absolutely not. Do I also believe that Medicare supplements are the right thing for everyone? Also absolutely not. What's right for you is going to be different than what's right for someone else. And that's why Medicare Advantage is super popular, despite what YouTubers say. So now, if you're still undecided and you want to go even deeper into a comparison between Medicare Advantage and Medicare supplements, then check out this video next.